Yeah, there are several. I would say the couple that I see frequently in my practice, one is that, you can kind of create any kind of nose in any kind of patient. So that presents usually with someone coming in with photos of their favorite celebrity or influencer that may have been or may not have been photoshopped or altered or airbrushed or what have you, and hoping for that kind of outcome. And I would say those are rarely useful because most of the time you're limited by what your starting point is. Everyone's anatomy is different, and everyone's skin is different, their structures are different, and we have to be able to make changes within the parameters of what's achievable realistically and safely. So I think that's one of the common myths, that you can kind of achieve any sort of celebrity nose that you like and come in with photos and show that. I think it's more helpful if you're seeing a surgeon to show photos of their work that you like rather than just your sort of random celebrity or influencer. So that's one myth. Another myth is that, it's a very painful or uncomfortable recovery. It really isn't. Most people after rhinoplasty will note that their discomfort is brief. My patients in Manhattan having rhinoplasty, aka nose jobs, are feeling fine after a couple of days. And very often I have patients taking no strong pain medication, but we give it to them if people need it, and everyone's pain thresholds are different. So that the pain issue is one. The other issue is that, it's going to look good early, your results going to look great right away. And I tell everybody when I in the surgery that, at a week it's going to look at its worst. So when the cast comes off, it's going to look swollen and it's going to look its worst. It's not going to look great. I tell patients, look, if it looks perfect at a week, it's not going to look great at a year because things change with swelling and healing. So that's another important myth that I think a lot of people have about rhinoplasty. Another myth is that, anyone can do it, and I mean, anyone meaning any plastic surgeon can do it, and that's simply not true. You really have to see someone and seek someone out that's a specialist and focuses on it. And rhinoplasty is a demanding procedure. Revisions are possible in anyone's hands, but I think in an expert's hands and in somebody who has revision experience doing revisions of other doctors' work, if something were to happen, then you're in good hands with getting that sorted out because there is always a chance of that in anyone's hands, but you're less likely to have an outcome that's not satisfactory if you're going to someone whose style you like and someone whose focus is on rhinoplasty. So another myth about rhinoplasty is that the results are very obvious and that you can tell from a mile away if someone's had a nose job or a rhinoplasty. And that's simply not true. If it's done with structure in mind, preserving function, preserving natural anatomy, you can have a very significant, elegant, beautiful change that looks very natural. And what I mean by natural is it fits your face, it doesn't stand out, and it doesn't distract either you or potentially someone else. So natural, beautiful results are certainly achievable without looking like you had a nose job. And I've had many, many patients tell me that their friends and family can't believe they had surgery. It looks so natural and fits their face so well. And that's what I really strive for. I don't like creating overly stylized noses. I don't really like it because they tend to look very good for a limited amount of time, but not stand the test of time as people age. The most part, that's the most rewarding part of what I do is having a happy patient. I mean, happy patients make me happy. So when I have a happy patient, I'm smiling ear to ear. So that's always my goal. And that's the most important thing in what we do.